What are the questions you get asked the most?
There are some questions that people ask everywhere, regardless of the country. A lot of my full mouth implant videos get uploaded as shorts, and when people see them, they're all really surprised. Some people say, wow, you put in so many, it must be strong and good, and they like it. But others ask, why did you put in so many unnecessarily? Too many implants, that's what they say. Too many implants, they say. So, weren't you just doing it to make money? There were actually quite a lot of comments criticizing me like that. When someone with no teeth at all gets implants, usually the implants are placed and then you wait about 3 to 6 months before completing the prosthetic. That means you have to live without teeth for 3 to 6 months. Can you imagine that? Wouldn't it be really hard to go even a single day without teeth? I tried to imagine what it would be like if I had no teeth at all and needed implants. I realized I couldn't stand even a single day without teeth. That's why no matter what, I always thought I needed to have teeth, regardless of whether they were immediately functional or not. Then I opened my practice in 1995 and started performing implant procedures in 1998. And during that time, I attended a seminar where I heard an incredibly groundbreaking lecture. Immediate loading. The principle behind immediate loading is that for an implant to bond with the bone, no force should be applied. So you need to have a sufficient number of implants. They need to support each other, like putting their arms around each other's shoulders. By linking arms, they can collectively bear the force together. The more implants you have, 2 are better than 1, 3 are better than 2, the more they can rely on each other. The right and left sides also need to be connected. So, when you chew on the right side, the left side needs to compensate. This is the principle at work. That's why when there are only a few implants, it feels unstable. So, of course, even with 8 implants in the upper jaw and 6 in the lower jaw, immediate loading can still be successful. But this is what patients often do. They go from having no teeth to suddenly having teeth. Then the doctor tells them, you need to eat soft food. Of course, some people follow these instructions well, but there are definitely others who don't. So, since I can't know for sure whether this person will follow my instructions or not, I end up placing enough implants just in case. But when that happens, patients worry that getting more implants will cost them more money. That's their biggest concern. So I thought, even if I don't charge the patient extra, isn't it more important that things are easier for me? That's how I started thinking this way. So instead of setting the treatment cost based on the number of implants, I just set a fixed price for the entire upper jaw and a fixed price for the entire lower jaw. For the upper jaw, you usually need at least 8 implants. For the lower jaw, you need at least 6 implants. So I only charge for that amount, and I don't charge extra for any additional implants I place in between. Instead, what I don't want is to have to do the work 2 or 3 times. That's how I ended up placing so many implants.